Good afternoon, everyone, and welcome to our seminar series. My name is Dr. Rob Murphy, and I'm the Executive Director of the Havey Institute for Global Health and the John Fair Professor of Infectious Diseases, and now the Interim Chief of the Division of Infectious Diseases here at Northwestern. Thank you for taking the time to join us this afternoon for our latest installment in the Havey Institute for Global Health seminar series. The correct title is actually A Decade of NIH-Sponsored Research and Training in Nigeria, My Experience by Benga Silas, MBBS, excuse me. Please take a moment to follow us on Facebook as well as Twitter and Instagram at #FSM Global Health. In addition, we welcome you to become an Institute member to receive access to specialized resources and services that support research infrastructure. For more information, you can visit our website at globalhealth.northwestern.edu/members. Today, we're thrilled to host my colleague and friend, Benga Silas. He's from the University of Jos in Nigeria for this seminar event. And we've been working in Jos since the APIN days around the year 2000. So a lot of experience at his university. Professor Silas is a distinguished Nigerian medical doctor specializing in pathology. He holds a position of Professor of Gynecology Pathology at the College of Health Sciences, University of Jos, and serves as the honorary consultant pathologist at the Jos University Teaching Hospital, or JUTH. Silas has previously been Deputy Dean of Clinical Sciences at the University of Jos and was recently appointed Dean of the Faculty of Basic Clinical Sciences at the same institutions. Congratulations. With over 2 decades of experience in cancer diagnosis and research, Silas has a particular focus on HIV-associated cancer epidemiology in low and middle income countries. He earned a Master of Sciences in Health Services Outcomes Research here at Northwestern as part of our Fogarty International Training Program. That was our NCI-sponsored Northwestern and Jos University Research Training Program in HIV and malignancies, also referred to as NNHAM, which has most recently been led by Dr. Li Feng Ho and myself. And now that grant has been taken over by Professor Silas. And so congratulations for you on that. There's going to be time for questions following the presentation, and we welcome you to submit questions through the Q&A feature here on your screen. And so put those in, and we will do those questions at the end. And now, Dr. Silas, I turn it over to you. And thank you very much for joining us today.
Thank you very much, Rob, and thank you to the leadership of the whole Institute of Global Health for having me. Thank you, Li Feng, for nominating me for this presentation. And thank you, everyone. So indeed, National Institute of Health has had a lot of collaboration in terms of training and research with institutions in Nigeria for up to 2 decades. But my experience is spans over 10 years, which is a decade, and that's what I'll be talking about today. I'll quickly acknowledge the institutions that have been involved in this relationship over the years. The Northwestern University, the University of Jos in Nigeria, the University of Lagos in Nigeria, and University of Ibadan in Nigeria, NIH, and Fogarty International, and NIH National Cancer Institute, and the Harvard Chan School of Public Health. Next slide, please. Next slide, please. Hello, Meg. Next. Okay, thank you. Yes. So indeed, my relationship with NIH has been over a decade right now. We know that NIH has indeed sponsored a lot of research and training initiatives at various Nigerian universities, and it has been pivotal to capacity building especially in University of Jos, where I presently working, University of Lagos, University of Ibadan. The institutions, U.S. institutions involved in this collaboration are majorly Northwestern University and Harvard, and they have been great source of mentorship and training, and indeed collaboration with our institutions. And the trainings that we have had from NIH has been either short-term trainings like seminars, workshops, medium-term trainings, like enrichment programs in the US, where faculties go to gain a lot of skills and also gain competencies in certain areas of specialty. Then we also have the long-term trainings like the master's program and the PhD training programs. These trainings are either online or in person. And all these trainings have actually improved research capacity in our institutions in Nigeria, especially HIV-associated infections, capacity for research in non-communicable diseases and malignancies. And the funders, the NIH institutions that have been responsible for funding most of these training and research initiatives have been Fogarty International, National Cancer Institute, and the National Institute for Bioimaging and Bioengineering. Next slide, please. All right, my story. So my story that initiated my experience started from way back 2015. So in 2015, I was opportune to be nominated and selected for a master's program at Northwestern University, funded then by the Northwestern University and University of Jos Research Training Grant, which was a D43 grant. It was a worthwhile experience. I really had a very fulfilling time and very successful in my program there. And I must say here that the success I had could be attributed first and foremost to the support that I received, first and foremost to the leadership and the whole personnel of the then Center for Global Health. I know now it's Institute of Global Health, but it was then Center for Global Health, and the executive, the director was still Robert Murphy. Other staffs were very helpful in assisting me to settle home and not to be distracted from my studies. So we had Chad, who is still a very notable investigator with us, Claudia, Ashti, Daniel Young, Elizabeth, and later I came in contact with Lifang Ho. And they have been very instrumental to helping me to assimilate and accommodate all the things I needed to do. And I was very successful. And indeed, in 2016, I obtained a master's in health sciences and outcomes research. And I returned back to Nigeria with a Mentored Seed Award. And my project that I was to complete in Nigeria was on the outcome of HIV-associated lymphoma in a resource-limited setting of Jos. My mentors that assisted me and guided me were Chad Akindele, of course, Robert Murphy, and Lifang Ho. And we published the paper in Infectious Agents and Cancer in 2014. And it was very successful. The picture you see there is me and one of my professors in one of my presentations in the class. Thank you. Next slide, please. Okay, so here I will just highlight some of the various projects that are funded by NIH in Nigeria. These are just a few. There are many. Because of time, I will just mention these few. So the first is the MEPI project, the Medical Education Partnership Initiative in Nigeria. It was funded by Fogarty International and the contact PI was David Olaleye, and the collaborating institutions were University of Jos, Northwestern University, and University of Ibadan. Then we had a D43 grant called Northwestern and Jos University Research Training Program in HIV and Malignancies. It was a big program, and the contact PI was Robert Murphy, and the funders were also Fogarty International and NCI also. The collaborating institutions were University of Jos and Northwestern University. Then the same grant after the first circle, we had another circle, now christened NNHAM, Northwestern Nigerian Research Training Program in HIV and Malignancies. And the funders were Fogarty International, and the contact PI this time around was Lifang Hu. And the collaborating institutions were University of Jos, Northwestern University, and University of Lagos. We also had another grant funded by NIH, which is a U54 grant, Epigenomic Biomarkers of HIV-associated cancers in Nigeria. And this grant was very big and successful and had two projects. The first one was HIV-associated hepatocellular carcinoma, Project 1, and Project 2 was on cervical cancer. And the contact PI was also Lifan Hu, and NCI was the specific funder, and the collaborating institutions were Northwestern University again with University of Jos, and this time around added University of Lagos. So the first circle, it was only University of Jos and Northwestern, but this circle was three institutions, University of Jos, Northwestern University, and University of Lagos. So we also had another project, the IKEA project, intensive combination approach to roll back the epidemic in Nigeria. And the contact PI was Babafemi Taiwo, and the funder was National Institute of Child Health and Human Development. And the collaborating institutions were University of Ibadan, University of Jos, and Northwestern University. Next slide, please. Well, other projects, notable projects, were one, the CITAN project as the Center for Innovation for Point-of-Care Technologies for HIV/AIDS in Northwestern University. Now, the PI was Robert Murphy again, and the funder was National Institute of Biomedical Imaging and Bioengineering, and the collaborating institutions, Northwestern University and University of Jos. We also had the sequelae of Lassa fever, an R01 project, whose PI was Slobodan Pesla as the contact PI, and funders was the National Institute of Allergy and Infectious Disease, and the collaborating institutions were University of Jos and University of Texas Medical Branch. We also had, and right now still ongoing, a very successful so far U01 project called the West African Self-Sampling HPV-based Cervical Cancer Program, WASH for short. The contact PI is still Lifang Hu, and it's also an NIH sponsored program by NCI, and the collaborating institutions this time around is University of Jos, Northwestern University, and University of Ibadan. Lastly, we have the CITAN grant again project, Center for Innovation in Point-of-Care Technologies for HIV/AIDS and Emerging Infectious Diseases at Northwestern. This time around, it was renewed just this year, and the PI now is Chad Akindele, and the funder was National Institute for Bioimaging and Bioengineering, Indeed, it was renewed this 2024, and the collaborating institutions are Northwestern University and University of Jos. Next slide, please. So I have just discussed some of the projects that are funded by NIH, but very importantly is another project, the HBNU project, which is a Fogarty Global Health Training Program. The institutions that are involved in this includes the Harvard University, Boston University, Northwestern University, and University of New Mexico. This program offers fellowship opportunities at 21 sites in 14 countries in Africa, Asia, and South America, and provides a one-year mentored research fellowship opportunity in LMICs for pre- and postdoc candidates from the US or LMIC. They fund research in HIV/AIDS, non-communicable diseases, mental health, maternal and child health, nutrition, and others. Very importantly. Thank you very much. Next slide, please. Okay, so as we have seen, NIH has been involved in a lot of projects, funding projects in various institutions in Nigeria, aiding research and training capacity for building capacity and skill acquisition. But very importantly, to my own opinion, or in my own opinion, is the success achieved with the D43 HIV research training programs. The D43, as you will see, has about 3 circles. We are in the 3rd circle right now. We have been fortunate to be funded ever since. So the first one started the 1st circle, 2014, and spanned about 5 years. Then it was named Northwestern and Jos University Research Training Program in HIV and Malignancies. Then it focused on training and research capacity for epidemiology, clinical and laboratory research in HIV cancers. And we had MPIs, Robert Murphy and Li Fang Hu. And we had our site PI in Jos then was Professor Sagi. After completing the 1st circle, we also were awarded for the 2nd round, 2nd circle in 2019. And this time around, it was christened NNHAM, Northwestern Nigerian Research Training Program in HIV and Malignancies. And the uniqueness here was we had added another site, Lagos, which you hear. The focus was to develop our capacity in cancer molecular epidemiology, biostatistics, bioinformatics, and biomarkers. The MPIs were also Robert Murphy and Li Fang Hu, and our site PIs in Jos was Sage, and the site PI in Lagos, Ogunshola. Next slide, please. So this D43 research training program in HIV actually spanned for 10 years. And in these 10 years, we actually had a lot of accomplishments. A lot of accomplishments, not only in training, but also in research. And I will be seeing some of these. So very importantly in training is that we were able to train 2 PhD degree candidates in Northwestern Health Sciences Integrated Program. One of them was Jonah Musa, was the first that successfully trained in cancer epidemiology, cervical cancer epidemiology and prevention. We also had Akambi Maxwell in lung cancer epidemiology and prevention. Then we also trained 7 Masters of Science degree programs, candidates in various specialties. We had candidates trained in Master of Science in Health Services and Outcomes Research, in Clinical Investigation, in Epidemiology, in Health Analytics, and Bioinformatics. So during this 10-year period, we also had 9 mentored seed awards, and over 18 staffs had the opportunity to go to the Northwestern for faculty enrichment experiences and obtained a lot of skills during their period there. We also had a very successful grant administration workshop that had participants, over 70 participants, comprising of University of Jos staffs and faculty, and they were very impressed with this training. So we had multiple short, medium term and trainings, workshops, and experiences. And our faculties gained a lot from all these trainings. We also had 13 trainee first authored publications coming out of the various research initiatives that occurred during this period, and 2 important supplements that transformed a lot of research initiatives in Jos occurred, and Lagos then. So the first was the one for the cancer registry linkage. So the first supplement aided our cancer registry's ability to collate data from the population. Before now, the cancer registry data was basically a hospital-based data, but with this catalyzer fund, this supplement, we were able to expand our reach to capture and collate data from most of the health centers in many of the local governments at Jos. And we also had another supplement that enhanced and established telepathology between Northwestern University, University of Jos, and University of Lagos. This telepathology helped to reduce patient waiting time and improve diagnostic skills of pathologists, and it also helped in training. It was very useful during the COVID era. Next slide, please. So apart from the training accomplishments, we also had, during this 10-year period, we also had a lot of grant achievements and support. The first is the R21 grant. And you will notice that most of these trainees had been the ones that had been trained to be able to write proposals and win these grants. So the R21 grant, the project topic was global hypomethylation biomarkers for cervical cancer screening in women living with HIV. And the MPIs were Silas and Zeng. Silas, that's me, Jos, and Zeng in the Northwestern University. Then we had the K43 grant, vaginal microbiome in cervical intraepithelial neoplasia and cancer. The PI was Jonah Musa. Then we also had a U54 grant, the epigenetic biomarkers in HIV-associated cancer in Nigeria, and the PI, MPIs were Lifang and Murphy. Then we also had the U01 grant, which is the WASH grant, West African Self-Sampling HPV-based cervical cancer control program. We had MPIs, Lifang Ho, Mahmoudou Miaga, and Jane Hall, all of the US. Then we also had another program, a U54 program, which I talked about, grant, the Center for Innovation for Point of Care Technologies for HIV and Emerging Infectious Disease. And the PI is no other but Chad Akemba. Now, these programs have really helped us, and you will see the various advantages that we have had, not only with the training, but these programs. They were occurring concurrently, and most of the co-investigators were drawn from University of Lagos, University of Ibadan, and University of Jos, and being mentored by their colleagues in the US. Next slide, please. Okay, So after these two circles of the D43 HIV research training grant, there was another announcement, a funding opportunity announcement by NIH, and we took advantage of it. So researchers from Jos, Northwestern University, and Lagos met late last year at Lagos on site and looked at the gaps that we had in our research capacity. And we recognized that we had gaps in molecular epidemiology, biostatistics, bioinformatics, clinical validation of biomarkers, and diagnostics. So we decided to tweak our write-up as we applied for the project in line with these gaps. Next slide, please. So we had about 3 aims for this current cycle of D43 research training grant. So the first aim is to train a candidate in molecular cancer epidemiology and clinical investigation. And these candidates will acquire skills to be able to conduct a population-based epidemiology studies, also to develop protocols for biospecimen handling, developing biomarkers, and point-of-care tests. This is aimed at early detection and screening for HIV cancers, HIV malignancies. We also hope to train at master's level candidates in biostatistics, clinical investigation, and epidemiology. Our third aim is to create a multidisciplinary research team led by Nigerian investigators. So this was our uniqueness. Next slide, please. Now, you will notice that from the former grants, the 2 circles was structured, and the leadership was also structured around our Northwestern colleagues. But this time around, in this 3rd circle, the new thing there is to make it a Nigerian structure and leadership model. So from this chart that you see here, you discover that most of our Nigerian mentors who were associated with our 2 circles in this grant had now become training advisory committee members. Ogunshola, Sage, Lesi, and Mafuye. And the only US member of this committee was Murphy. And some will say Murphy is also a Nigerian based on his experience with us. So the principal investigators now were basically mostly from Nigeria, apart from Chad. So we have Silas, me, as the contact PI, Jonah Musa as MPI, from University of Lagos, Odukoya Kemi as MPI, and Northwestern University, Chad as MPI. And this project has about 4 components. We have the molecular cancer epidemiology component, the HIV co-pathogen and diagnostic component, the bioinformatics and biostatistics component, the cancer pathology and genetics component. And you will discover that in all of these components, the leadership role is taken by Nigerians. So Musa and Zwaka will lead the molecular and cancer epidemiology component, and Imade and Akamu will lead in the HIV co-pathogen and diagnostic component. Nenrod and Odukoya, all from Nigeria, will lead in the bioinformatics and biostatistics component, and Silas and Abdul Karim will lead in the cancer pathology and genetics component. So indeed, this is a new Nigeria-centered structure and leadership plan for the present and the current D43 HIV research training grant that we just acquired. And we are grateful for the opportunity. Next slide, please. So the focus of our new research training grant, indeed, as I have said, is to train candidates in PhD, molecular epidemiology, and master's degree level for epidemiology, biostatistics, clinical investigation. We will have a lot of faculty enrichment programs. We will also have seminars, workshops, and this training is aimed at eventually identifying unique biomarkers in HIV malignancies that can aid in early detection, that can aid in screening, and we will also take advantage of these biomarkers to produce point-of-care diagnostic kits. We also hope to collaborate with other D43s. So there are other D43 grants in some other institutions in Nigeria. We hope to collaborate with them, especially looking at where we can also train some of our investigators. Also, so by 21st of June this year, we got our successful notice of award for this particular grant. And we have started meeting and started having fruitful discussions. So, but as you see, eventually we hope to be able to develop ideal biomarkers that will help in prognostication, diagnosis, as therapeutic targets, in precision medicine, and overall to improve clinical outcomes of patients. This is our focus with this current grant. Next slide, please. So I really want to discuss here the achievements that we have had, especially from these HIV research training programs. Now, these achievements are not only on the trainees, but also on the local Nigerian mentors. Apart from that, the institutions have achieved a lot due to the interaction with NIH funding and the nation as a whole. So we'll be looking at it. So the first is that the long and the medium-term trainees have returned back to their primary institutions. This is very important, and NIH would like to continue to support such moves. So we have returned back to our primary institutions to continue to engage in research and train others and put to bear all that we have learned from the US. These trainees have also progressed, as you have seen, to become co-investigators, PIs, and multiple PIs. And these trainees have also been able to, by themselves, with other colleagues, gain and acquired grants. We have the K43, we have the R21, the U54, and the D43, and many others. So this has been a lot of progress in the careers of the trainees. The yesterday trainees have become today PIs, co-PIs, and now mentors too. So also our then mentors have also progressed to become scientific resource persons to various institutions in the country. And many of them are trainee advisory committee members of various grants. Our institution has also gained from this collaboration. So our institutions have become research and training hubs for the sub-region. So this has really opened up our research capability and has opened up training and capabilities and capacities of our trainees to other institutions in the sub-region. Also, our networking collaboration has improved. Now we are networking with other sub-Saharan African countries and institutions there. Like the WASH program, we're actually collaborating with an institution or some institutions in Mali, and it's been very successful so far. Very importantly is the fact that all this period, this 1 decade period, we have been able to successfully bank a lot of specimens, a lot of tissue specimens, blood, urine, and some other samples. These are very necessary to answer various research questions in future. And also, we have been able to bank a lot of data, clinical data, laboratory data, other data. And especially is the linkage between our cancer registry and the HIV adult clinic data. We have been able to link this courtesy of the supplements that we got during the program. Very importantly is that most of our trainees that have become mentors and our Nigerian mentors have progressed academically and administratively in their career. And we will look at some of these. Many of them have become heads of departments of their various departments and institutions. Many of them have become deans of faculties. Some of them have become board members of various institutions. And many of them have become examiners to various undergraduate and postgraduate health institutions and colleges. Very importantly is the fact that the government, the federal government of Nigeria, appointed some of them as vice chancellors of these institutions. So indeed, the current vice chancellor of University of Lagos, Professor Shade Ogunshola, has been part of this story and this journey, and this is a great plus for us. Also, the former Vice Chancellor of University of Jos, Professor Howard Mafiel, is also part of us. And we also have chief medical directors that have been appointed by the federal government of Nigeria from this association and collaboration. So the first is Professor Barnabas Mandong, who is currently the chief medical director of Babcock University Teaching Hospital. This is a faith-based hospital in Western Nigeria. And also, we have Professor Adeyemo, who is the current chief medical director of Lagos University Teaching Hospital. These are great pluses for us. We are also aware that the former one-time Minister of Health, Professor Adewale, has also benefited from this collaboration. And so, indeed, not only the trainees, but also our mentors, our Nigerian mentors, have gained recognition and have advanced in their career through this collaboration with NIH. Numerous publications have also arisen from our interactions, and most of these publications are in high-yield peer-reviewed journals. Thank you very much. Next slide, please. Well, indeed, I've talked so much about the advantages and the gains from trainings and skills that have been acquired due to the programs that NIH has funded in Nigeria. But permit me to discuss the recent challenge that we are facing in Nigeria. And that is the challenge of losing most of our competent hands to developed nations, called the brain drain syndrome. And in Nigeria, it's called JAPA syndrome, JAPA for short, but it's the brain drain syndrome. We noticed that most skilled personnel in the country are looking for ways to move to greener pastures, so to speak. In 2020, Association of Nigerian Physicians in America published in a paper and reported that over 3,895 Nigerian educated doctors are licensed to practice medicine in the US. So this is a challenge. And GMC reports, GMC is in UK, in 2023, positioned Nigeria as the third largest non-UK graduate contributor of doctors to the UK workforce, trailing just behind India and Pakistan. And just March this year, the Minister of Health of the Federal Republic of Nigeria in a daily reported that in the last 5 years, over 16,000 doctors have left the shores of Nigeria. So this is a bit challenging on the health infrastructure of the country. And I will just discuss my own view of the pull and the push factors that are making Nigerian doctors or health workers to leave the country. Next slide, please. So by pull factor, I mean, what are the factors in the Western world that are pulling Nigerian doctors and Nigerian health workers to the US or UK, as the case may be? So the first is the safe learning, research, and working environment. Indeed, this is a challenge in Nigeria. So most will rather jump to any opportunity or jump at any opportunity to leave the country for a safe learning, research, and indeed working environment. The second is the good wages. The economy is biting hard in Nigeria, and so going outside the shores gives opportunity for good wages. Also is the issue of stable government health policies. So we believe that in the Western world, their health policies are more stable than the one that is obtained in Nigeria. Then better opportunities. So also they believe that you have better opportunities in the US and in the UK. So these are the pull factors: better health systems and facilities. Well, the push factors are the factors in Nigeria that are helping to push their workforce away. One is poor wages. So the doctors and the health workers have always been agitating for increase in wage commensurate to their colleagues in other climes. This factor, if not addressed, will continue to aid them to move out. The other one is poor working environment and facilities. So there's dearth of good working environment, and we do not have much sophisticated facilities to address health challenges. Then the issue of unstable government health policies. This has to be addressed by the government of Nigeria. And the impact of COVID. So COVID actually impacted the economy of the country. And during this period, a lot of Nigerian health workers actually left the shores of the country. Another is work-related burnout. So with the death of and the dwindling human resource, the few doctors and health workers that remain are worked out, and therefore they burn out. So this is, if they have any opportunity, they might just leave. Then the issue right now that is burning, that is very dear to our hearts, is the issue of insecurity. So as some of you might have heard, so much insecurity in almost every part of the nation of Nigeria. And recently, there has been targeted kidnaps of even doctors. So doctors have gone on strikes, associations, because of this. So these are some of the factors. Next slide, please. So in this slide, I try to probably discuss suggestions that I think will improve retention of trainees back in Nigeria. So we want to improve retention of trainees back in Nigeria. First and foremost, the government of Nigeria should improve wages and working conditions in our society. Also, we advocate for more online programs. We also will encourage programs at other African institutions. There might be other African institutions that have similar programs, like South Africa, probably some East African institutions. We'd like to encourage that our trainees obtain their training in those places, and maybe just a few in the Northwestern University. Sharing duration of program between local and foreign institutions. This is a hybrid kind of arrangement that we are hoping to leverage on in this our current cycle of D43, where candidates who are already in a PhD or who will start a PhD in Nigeria, but will later probably spend some time in some competencies in Northwestern University. Then to establish more standard training and research centers in Africa. This is so that it will be easy to train citizens around Africa, and they do not have to go out. And also to improve the security situation. This is very important. Thank you. Next slide, please. Okay, so my desire and personal proposal for the future of NIH research training in Nigeria goes thus. One, to establish a standard biorepository at JOS, my beloved institution, to serve as a hub for the region. So if I was opportune to visit the biorepository lab at Northwestern University, and it was so inspiring. With biorepository of a good biorepository lab with samples, you will be able to have enough samples to answer research questions. So we are hoping that if we get the opportunity of establishing this biorepository in JOS, it will help our research endeavors with NIH. The other is creating a national research institute for training and research in the sub-region to raise the next generation of researchers. We have very intelligent people, young people in Nigeria who are research-minded and might not have the opportunities that we have had. But if we are able to establish a national research institute in Nigeria, it will help a lot. Then also the formation of regional research and training consortium, networking with other institutions in sub-Saharan Africa. We have, over the years, realized the importance of team science and multidisciplinary science. And we also know about generalization. So the more we collaborate with our neighboring countries, the more we strengthen ourselves and the more we are able to develop the sub-region. So these are my proposals. Next slide, please. Well, I would like to, before I finish, like to acknowledge very profoundly all these institutions and personalities that have really been involved in sacrificing over the years their time, their energy, and their finances for the furtherance of research and training in Nigerian institutions. Fogarty International Center, the National Cancer Institute, the Office of AIDS Research, the National Institute of Allergy and Infectious Disease, and the institutional administrative support from Northwestern, from Harvard, and our local ones from University of Jos, University of Ibadan, University of Lagos, and also like to thank Dr. Bansa Gita, that has been our program officer for some of our grants, and the grant management specialist, Vicky Grant. I would like to thank them. I would like also to thank the Institute of Global Health staffs, including Meg and Kate, that have guided me through this. And lastly, I would like to thank my mentors, Robert Murphy, Lee Fang Hu, J.J. Wee, Chad, Shade Ogunsola, Sage, and Mandong. Next slide, please. I have some beautiful pictures just before I close. Now, these are my beloved mentors. I cannot finish this presentation without really talking about them. Like I told you, my success in my training in Northwestern will be attributed to the impact of these personalities in my life. The first is Professor Robert Leo Murphy, a professor of infectious disease and biomedical engineering. He is the John Fair Professor of Infectious Disease and Executive Director of Institute of Global Health and Center for Global Communicable Diseases. Then also Professor Lee Fang Hu, who is a director at the Robert Havey Institute of Global Health, Center for Global Oncology. She is also Chief of Cancer Epidemiology and Prevention in the Department of Preventive Medicine. I'm grateful to them. Also is Professor Jian Hui, the Director of Gynecological Pathology at the Department of Pathology, Northwestern University, and is also a Floyd Patterson Research Professor of Pathology. Next slide, please. Now, well, you can see this is where I trained, and many of us, Jonah Musa, Akambi, and many of us, this is where we trained at the Northwestern University Feinberg School. We are grateful for the institutional support. We are grateful for the environment and the training. Next slide, please. Now, photo speaks. You will just be looking at some few photos which will tell you my story. So this was when
you have
and
only
Jonah.
8 minutes for questions. Sorry for the interruption.
Okay, thank you very much. Yeah. All right, I guess I've finished the presentation. These are just emotional pictures. Thank you very much. I really want to thank the leadership of Institute of Global Health, Robert
brought
Murphy,
us back.
Thank you very much.
Well, thank you. Thank you, Silas.
Thank
that
you.
was great. Li Feng, you want to lead the question and answer?
Sure, Silas, thank you for the great presentation, the great summary of the history of not only you, but JAWS. I think today the talk actually want to focus on you as a successful story for our training program, right? So that initiated by Dr. Murphy. Great talk. So I would like to open to the questions to other audience. I see someone raised his hands. Is that anyone raised their hands? Or you can send your questions through chat. So
Well,
if not, someone is asking. Let me read.
Oh, that's me. I was just wondering, so where do you see yours? You've had quite a track record. Here was a question from Marco Colo. What were the challenges in your master's class training?
Right, the challenges. Okay, I didn't want to mention that, but the first challenge that I had was in the diction, pronunciation, because that was my really first time of attending a school in the US. And so the way they pronounce things was a little bit difficult initially. Then the second was the fact that it was a paperless training. I could remember I was not able to type fast, and Rob had to call me to his office and ask me if I knew how to drive, since I learned how to drive. And so I could easily learn how to type. And so these were just the major
to cook.
Then to cook. I did not know how to cook. But Rob and
You lost a lot of weight.
Yeah. But I went through after. Thank you.
So I have a very important question. I think many trainees who are in this audience want to know. So what is your advice to become a successful researcher after you have received all these trainings? What is your advice to our trainees?
Thank you so much, Li Feng. The first advice to all the trainees is to be humble and to be desirous of learning, because it's all about collaboration. You have to learn from those that know. So you must be humble, you must be focused, and you must be desirous of learning. Also, you must be inquisitive and intuitive. You have to be able to develop projects and share with your mentors, and they'll be able to guide you. Our success today is actually due to the mentors that we have. We have very wonderful mentors. You can see them here, and they were the ones that raised us up. So this is my advice: to listen to your mentors and be research-minded. Don't be distracted. Be focused on answering research questions, and you will be successful. Thank you.
Thank you, Silas. There's another question. There's no name. I can read. What are some of the challenges trainees have faced getting their own independent funding after completing the HBNU fellowship, D43, something, any training programs? This is a very good question. Whoever asked, thank you so much.
Well, the challenge will be how to navigate application for various grants. You know, to apply for grants, you need to know the technique. There's a science and there's an art. And the best way is to learn from those that are already have grants and those that probably are our mentors. So there are a lot of opportunities to learn from them. Like this D43 right now, we'll be having a lot of workshops, a lot of seminars that will teach you how to, on manuscript writing, on grant writing. These are opportunities that you can learn from. It's, they have also taught us that once you miss it the first time, you don't lose hope, you don't get depressed. You brace up yourself and move again. Then they also taught us team science. So if you learn to collaborate with other people, you can learn from one another. So, but if you want to do everything alone, then it will be bad. Thank you.
And listen to what Silas is saying, okay, everyone. It's very important. So, Claudia, you asked, but I don't see your question. What is your question? Claudia? Okay.
Maybe she just wants to
Your
breathe.
question, I don't see it. You just said Claudia asked. Can you just
I think her question was the one that Professor Silas just answered, actually.
Oh,
so I think
that was her question.
I think she was just
Okay.
sharing that was her question.
Oh, okay. So I am gonna add one more question, Silas. How do you connect your research, right? Identify or develop your research questions with your clinical work, because this is important for most of our trainees are clinicians. How they can develop their own independent research by using their training that they have received through the training programs to develop their own research questions, become an independent scientist. So please let us know. So
Well,
for example, you develop a cancer registry, right? Yeah.
Yeah. Okay, so if you look at the NIH website, various announcements that they make, they actually specify what they want to fund. So you cannot develop a research question outside the perimeter of what NIH institutions want to fund. That's one. And also, it's very important to also meet those that have been doing it before, who already have grants. They will also guide you. So the first thing we normally look at is to look at the NIH websites regularly and to see funding opportunity announcements that are related to our specialties. We will now be able to develop. If we read, we will read the instructions again and again and again and again. Then we'll be able to now develop our research questions and show our mentors, and they will guide us to cross our T's and dot our I's. Thank you.
Thank you. Any other questions? Rob, you are muted.
Sorry about that. We're at the top of the hour, so we're going to have to close the session now. I want to thank you, Silas, for sharing your insight and expertise with us today. And thank everyone in the audience for joining us and for asking the questions. We invite you to join us at our next Institute for Global Health seminar, Implementation and Cancer Health Disparities Research at the NCI Center for Global Health Equity, Collaboration, and Impact, which will be an in-person event featuring Dr. Patty Gravitt from the National Cancer Institute. The seminar is co-sponsored by the Robert H. Lurie Comprehensive Cancer Center and will be held in the Simpson Quarry Auditorium on Wednesday, October 2nd at the same time, 1 o'clock. You can register via the QR code here, our newsletter, or any social media pages. Again, thank you all for joining us today. A recording of the webinar will be available online and will be shared via our newsletter. And this concludes today's webinar. Thank you again, Silas, and thank you, Li Feng.
Thank you, sir. Thank you, Li Fang. Thank you, Rob. Thank you, everyone. Thank you.
Thank you, everyone. Yeah.